Okay, so in this video we're going to go through quick shoulder observation and inspection. So when you have a shoulder patient, the sorts of things you just be looking for initially when you first start assessing objectively the patient. So with Karina here, if we turn you around, Karina, to the back. So again, with shoulders, what I would be looking for is levels, so general levels of the shoulder. I'll be looking for things like spine to the medial border of scapula, looking for the inferior angle of scap, just where those are, and me and Glenn were just discussing, you can palpate those points really briefly, just even in the observational element. Obviously you're looking for colour changes, you're looking for any lumps or bumps, bruises, just general observation of that area, muscle bulk as well, so looking at general muscle bulk particularly. Again, inferior angle, if you've got, if you think you might have nerve injuries in the shoulder, like thoracic injury, thoracic nerve issues, then that can, obviously you're going to see big amounts of atrophy around there. So just looking generally at muscle bulk itself. Obviously looking at a little bit of the neck, just general position of that in terms of whether it's side bent left or right. Then if we get you round, Karina, facing towards there, perfect. So then obviously with the shoulder as well, from a side perspective, we'd be looking more at whether that shoulder was anteriorly translated, so whether it was forwards. Me and Glenn were also discussing before that, looking at the hands as well. So this is more from a front view, but in terms of, if we look here, we'd be looking at the thumbs and whether they're pointed inwards or outwards, and that would be a relative rotation of the shoulder. Thumb pointing inwards, obviously internally, outwards externally, and then we compare that. We were just discussing as well that just because they've got thumbs internally rotated doesn't immediately make you think that's an issue, but maybe if they had one that was more so, and that was the problem side, and then they had anterior translation of the shoulder, and they had other issues going on as well, it fits part of that clinical picture of potentially like an impingement type disorder or some sort of issue of that kind, where they're getting some impingement happening or some issues around that supraspinatus tendon. So that's the sort of thing that I would also look for. Obviously from the front, if you come around, I would also look just generally at pecs bulk, so just looking through the pecs as well, just looking to see again muscle bulk into the arm, again lumps, bumps, bruises, anything like that you're picking up. I don't know if there's anything else that you would add with shoulders, Ken?
Yeah, but just reiterating what you're saying about looking at side-to-side differences, I think that's really important and key. With the shoulder, it can all change the minute you get them to move anyway, but if there's something that's significantly standing out on the problematic side, then it's worth noting that, isn't it? Yeah. And I think again, we'll go into palpation in more depth on another video, but as Chris has been doing here, getting your hands on, feeling the pecs, pressing into infraspinatus, supraspinatus, really getting a gauge of if there's any tension or pain in those areas before you start to move is really useful as well.
Yeah, and I think that's where observation and palpation and all of the assessment techniques kind of merge together. It's not just something where you're doing one thing, then the other thing, then what we ideally want is a fluid assessment where you're kind of doing all these things because you're clinically reasoning through everything as you're going. Also for the patient, I think that's better as well, because you're kind of constantly confirming things with them as you go through, which really gives them an idea that, or confidence in you that you know what you're talking about basically. So I think that's a huge factor as well. But yeah, with the shoulder, that would be a simple, quick observation of the shoulder as you go through. Obviously that's going to relate into our wider objective exam, which we go through in other videos.